Are you ready? Let's go!
Don't you sometimes just want to talk about everything? You know, there's days when you can just talk about anything. Need to sit back and chat about nothing at all? Nothing But Julie, coming at you with fun and creative topics and interviews.
Did you hear Julie's podcast? She's got the greatest topics.
Come join the chat about everything, anything, and nothing. So unwind and tune in to Nothing But Julie. Great topics and cool interviews with some pretty awesome people. And now, without further delay, here's Nothing But Julie.
Hello, everyone. This is Julie Schrager, your host of Nothing But Julie podcast. Thank you so much for joining me today. You are in for a treat. I'm very excited to introduce you to Dr. Renee Exelbert, who is not only a licensed psychologist, but she is also a certified elite personal trainer. She received her BS from Cornell and her MA and PhD from NYU. She is the founding director of the Metamorphosis Center for Psychological and Physical Change, where she integrates psychotherapy and exercise with a focus on the mind-body connection. Such an incredibly unique thing that she does with that. She also served as staff psychologist at the Cancer Center for Kids at NYU Winthrop Hospital Cancer Center, where she worked with children and adolescents diagnosed with cancer. And we went to high school together. Welcome, my friend. Hello there.
Thank you so much for having me.
Oh, thank you so much for joining. I know that it took us a while to get here because you're so incredibly busy, which I can appreciate. So I'm happy for the time. So why don't we just dive right in? Renee is a breast cancer survivor, and that ultimately led you to becoming an author, a certified nutritionist, a certified personal trainer, a figure competitor.
Oh my goodness, all of these things from breast cancer. Oh my goodness.
I think that it's incredible. And lastly, and not only an author, mom, wife, and all that other wonderful stuff. So I'd like to ask you, Renee, was exercise a coping mechanism for you during your journey with breast cancer?
So I have always been athletic. That's always been something that's been part of my life. But literally the second that I was diagnosed with breast cancer, I started trying to find ways to empower myself. And one of those ways was obviously through literature and research. I had already been working at a pediatric cancer center. I literally left a pediatric cancer center after 6 years of working there. And 2 months later, I was diagnosed with my own breast cancer. So I already knew a whole bunch about cancer, about psychological coping mechanisms. So I already knew a whole bunch of that. But, the thing that happens when you have cancer is that you feel betrayed by your body. And so I was trying really hard to figure out a way to get back in sync. So through research, I knew that exercise was super important. I knew that food and nutrition was really important. I literally changed my eating habits immediately. I used to be a sugar addict. I would inject Laffy Taffy like, no drug you've ever known.
Oh, Laffy Taffy, huh?
Laffy
Wow.
Taffy, baby. And, and so I really changed things. In fact, I remember when I was in the hospital, my brother came with this giant bag of gummy bears and, and chocolate raisins and all the good stuff that he knew I loved. And I literally, the moment that I was diagnosed, I saw that sugar feeds tumors. And so I really got rid of sugar. And so exercise, became a really important way for me to regain a sense of control over my body. And the thing that was really neat was that I could tell my body to do something and then it would follow. And so it just allowed me to, get back in sync.
That's incredible. Was there one thing that you had learned about yourself, or more than one thing, throughout your journey?
Wow. So, I would say that prior to having breast cancer, I was definitely much more of a perfectionist. I was somebody who wasn't really so comfortable with allowing myself to be vulnerable. I was, I was much more competitive. And so having breast cancer and receiving that diagnosis at 37 years old was really, really challenging, because not only did it really challenge my assumptions about youth and about strength and about power and perfection, but it also really challenged my sense of femininity and beauty and all of these things. And so I think if I have to say, like, did I learn anything about myself? I went through a tremendous journey that took many years, where I really changed. I saw that the things that make me who I am have really very little to do with my accomplishments, have very little to do with my physical appearance. And so I just really learned that the things that make me who I am are the things that are deep within me, that will always be with me. And so I would say that has really changed me as a human being, and it's really impacted the way that I see the world and the way that I work with the patients who come to see me.
Mm,
And so there's so many. I mean, there's so many major life changes that have occurred because of cancer, but I would definitely say that it was a journey. It wasn't something that happened immediately. It was definitely a struggle that took a long period of time, but sort of when you come out of that storm, you look back and you're like, wow, I've really changed.
sure.
When I was first diagnosed, some people knew that I had cancer, and I shared with people that I had cancer, but I really didn't share intimate details of my journey. I was pretty private, and I sort of marvel at the way now that, like, I'll really tell anybody what I've been through. It's sort of shocking to me, because it just demonstrates such a dramatic change in the way that I see myself and the way that I see the things that we struggle with, the way that I see life in general. So for that, I'm very proud. And like I said, it really helps me be a better mother, wife, friend, psychologist, teacher, all of these things.
Hmm. What an incredible transformation. I know a few people that have gone through the same journey as you, and oddly enough, what you just said is so incredible. These people were very private as well. And it wasn't until with some of them, maybe 10 years later, that they opened up and spoke about it. And it
Yeah.
was, I think, exhilarating in a way, or, for lack of a better word, for them to just be able to start opening up and talking about it. And I saw an incredible difference with many of them through their journeys too. And with these changes, one of the things that came about was becoming a personal trainer after finding out how great exercise is, and beneficial for mental health. Do you have a certain mantra with your clients? By that I mean, is there a particular way that you would train your clients when it came to exercise and mental health?
Yeah. So, because I became so involved with exercise before I became a personal trainer. When I was working as a psychologist, I would have many people with whom I was working talk to me about depression or anxiety. And because I was so into exercise, and because I knew, all the tremendous benefits of exercise, I would start telling them that they should do squats and, push-ups. And I found myself demonstrating to many of my patients, the proper way to do a squat and push-ups. And then I realized, like, I'm not licensed really to do this. And that was also part of my, journey with becoming a personal trainer. I thought, like, wow, this will be a neat thing to integrate into my psychology. And after I got my certification, I became, I got certified in personal training, and I became certified in nutrition as well.
Hmm.
And I opened up this center called the Metamorphosis Center for Psychological and Physical Change. It's my baby, one of my babies, and I think it's probably the first place. I don't know of others where I truly integrate psychotherapy and exercise, and the way that I do that is something that's really unique. I work with individual people on whatever issue they're struggling with, whether it be an adolescent who's being bullied, or a woman who was just targeted, at her job with sexual harassment and is leaving, like so many different issues. And we first begin our work together with traditional psychotherapy, but then we integrate exercise and visual imagery. And so the way that might play out is, for instance, somebody who is trying to leave a very toxic work environment, after really learning her story, and hearing where she wanted to go in her life, we would then utilize exercise and visual imagery to sort of channel this new place. It sounds a little crunchy granola, new age, blah blah blah, but essentially, my office is half psychotherapy and half gym. And I would have this person come to the bench press, and she would lay down and do like chest flies, and we would literally, she would close her eyes and she would think about like her core and bring the weights to her core, her heart.
Sure.
And she would think about, where she has been and this sort of toxic place where she's been. And then she would literally open up into a chest fly and think about like the places where she wanted to go. And so sometimes we incorporate verbal mantras. Sometimes it's literally about just visualizing the place where you are and where psychologically you want to grow. And we use exercise and psychotherapy and visual imagery and sometimes verbal mantras to sort of move in that direction. So I have found it really beautiful work. I know the people with whom I do this work think it's, really empowering and beautiful as well. So, that's something unique, and I really love it and I really believe in it. And I also, believe in the same paradigm with nutrition, that, when we eat certain foods, it's not just the food that we're eating. It's really important to incorporate some visual imagery and some knowledge about the food in terms of what it's doing to our bodies. And so, I don't just eat food anymore. Food has become a very mindful practice. So when I'm eating, I have, literally researched hundreds of foods and learned their, mental health benefits, their physical benefits. So, if I'm eating walnuts, I know that walnuts are anti-inflammatory. I know that, there's serotonin in them, that they can actually help with our mood. And so if I eat walnuts, I'm thinking about not only the health benefits that I get from walnuts, but I'm thinking about how it can like literally change my mood. And so every time I'm eating food, I'm having this, experience in my mind, where I'm thinking about like how it's changing me, how it's empowering me. When I eat broccoli, I'm thinking about how it's getting rid of estrogen in my body, and that's helping fight away, any kind of breast cancer. So when you're watching your family members eat, they're just having their mac and cheese, and I'm in this la la land, in the corner, like thinking about broccoli and estrogen. But it's very empowering, and I do believe that research in the future is really going to support the fact that visual imagery when we eat and connect it with information about food can be really, really empowering and help us manifest a greater sense of physical and emotional health.
My goodness, it sounds amazing. I am aware of the connection with food. It's been a journey for me because I grew up in a house with, sugar, 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 sugar.
Mm.
And it took me a really long time to really lower the amount
Yeah.
of sugar. And
Yeah.
I will still have it. Because I just can't
Well, it's
stay away.
addictive. Yeah, it's
It is
addictive.
addictive, but I've gotten to the point where I've gotten so much better, so much better. And now it's just kind of like a little treat here and there. But it took
Yeah.
me a while, but I did it. I was steadfast in my journey.
Yay.
I know, I was so
And
happy.
I still have sugar, by the way. Like I still, love my Sour Patch Kids, but it is so rare. It is so rare when I have them. And part of that was because, I became a personal trainer, and I did this bodybuilding competition, and like I became very regimented with, when I eat junk. So I still have it because, I don't think that deprivation is ever a good thing. And I think, it's really, really important to engage in mindful eating when you sort of listen to your body. So if my body wants Skittles, I'll give my body Skittles, but most of the time my body wants broccoli.
I had read somewhere something about if you are in the mood for chocolate and you eat broccoli, it's almost like the same thing. Have you ever heard of that before?
No, but this is cool. I like that.
I
This is a cool thing. Wow.
it's funny coming from someone who really just loved sugar more than food itself forever ago. I remember being told this and I was like, yeah, okay, sure. And I have to tell you something, Renee. One day I tried it. I like eating raw vegetables, some kind of yogurt dip, maybe a little hummus, and I was in such a mood for chocolate and I'm like, no, broccoli.
Seriously, wow.
And
That
I ate
is
honestly, when I was eating, I'm like, this is not like chocolate. But then maybe like 15 minutes later, I did not feel that need for chocolate or sugar. It was amazing.
This is super, super cool.
I'm telling,
Can I tell you a very really funny story about
of
broccoli?
course. Yeah,
Because
yeah.
broccoli is like the topic of conversation now. Now that you brought up broccoli and chocolate, we have to talk about broccoli. When I was
Sure.
growing up, I hated broccoli. I thought it was the most disgusting food known to human beings. And I was probably about, I don't know, 9 years old. My parents had visited the Dominican Republic and they brought me back this beautiful brown leather pocketbook. And the very next day I went to my friend Stacy's house for a sleepover. And we were sitting at the dinner table and Stacy's mother brought out this big tray of broccoli and she put this heaping tablespoon on my plate. And I was like going to pass out. And she said, "You can't leave the dinner table until you
No.
have the broccoli." And I looked at Stacy like with panic, deer in the headlights, like you've got like. And I said, "Stacy, I can't eat the broccoli. Like I can't do it." And she's like, "My mother's not going to let you leave the table until you have the broccoli." And I'm like, "Really, Stacy, I can't do this." And so her mother left, and I didn't know what to do. I was panicked, and so I took a napkin and I loaded all of the broccoli into the napkin and I put it into this brand new, beautiful brown leather
God.
pocketbook. And I ran to the bathroom and I dumped all the broccoli into the toilet. And I was like, I was just it was such a terrifying experience. And I came back and I was so happy that like I was done with it. I came back and there was more broccoli on my plate. And Stacy's mother said, "Since you like broccoli so much, I gave you more." So I was terrified because I came home with these green stains in this beautiful new bag. And I told my father, I was like, "I'm so sorry, Daddy, that like I ruined the pocketbook." And he thought it was the funniest story and he talked about it for years. And so here you are talking about purporting the tremendous benefits of broccoli and how it's just like chocolate. And I will tell you, broccoli is it's my friend now. Now I've learned that it's like chocolate, but broccoli to me is literally like one of my favorite foods. And just from, a breast cancer perspective, it absorbs, it literally gets rid of extra estrogen in your body. So it can literally fight off breast cancer. And I also read that if you have caffeine past 3 or 4 p.m. and you have broccoli, it'll actually absorb the broccoli and take away the caffeinated effect in your body. So
Really?
kudos
Huh.
to broccoli.
Yeah.
Let's make a toast to broccoli.
Toasting. I have my
Yeah,
tea. I have my
there you
tea in my
go.
hand, so
There
I
you
will
go.
not
And
have
now
broccoli.
whenever I want chocolate, I'm going to reach for broccoli
You
because
have to let
Julie
me know.
told me.
Yeah,
For
you listen,
sure.
honestly, you have to let me know how you feel,
For
like
sure.
within a half an hour, because I was not a believer, and I honestly just the sugar craving was gone. And I
Wow.
actually thought at first when I was told about it, like, oh, it's going to taste like chocolate, you know, but what she meant was those cravings will be gone. But
That's amazing.
I can't eat broccoli on its own. I definitely need to have a dip unless it's steamed and I have it with my dinner. But
Yeah.
raw, I need a little something, something.
Or
All
just a
right.
little olive oil, salt and pepper, and roast it.
Yes.
That's the bomb.
And it's funny too. When you said that you never liked broccoli, I was like, get it away when I was younger. Get it away. Just the smell was a turnoff.
Right.
That smell of broccoli. And now me too. I love it. I want to broach the subject very quickly of the figure competitor in you. For those of you that are listening, you have, I could not believe the transformation when I saw Renee. And if you have a chance, yes, Google it because wow, the dedication is incredible, was incredible. And so did you win like two titles or what happened
Oh,
with all of that?
so titles would have been cool. No titles. I did win
Mm.
though. I did come in first place in my first competition, which was super amazing. But this whole idea of figure competitions. I was working with a personal trainer who happened to be a professional bodybuilder, and she used to do these competitions. And when we were training, we became really close. And she kept saying to me, Renee, you should do a show. And I said, there is absolutely no way in the world that you will ever get me standing in a bikini in stripper heels, flexing my muscles on stage. Like, it will just never happen. It was like literally against everything that I believe in. Like, it was just not who I was. And the more and more I worked out, the more I got, into this really shredded, shape. And people at the gym, they kept coming over to me and they said, are you doing a competition? And then the more people started coming over to me, the more I was like, well, what is it to this competition? Like, what do you do? And I was around the 4-year mark of having been cancer free. And, they say that 5 years is a great milestone, because you've passed, for many, many points past, the point of like highest recurrence rate. And so I thought, you know what, there might be a really amazing opportunity to celebrate this 5-year milestone with some way of proving to myself that I am now in control of my body. And so, although I already felt that with exercise, I would literally do bicep curls and I would see my muscles grow. And so I knew that I was in control of my body. Somehow the idea of incorporating the diet, and literally, doing the exercise, having your protein right afterwards, like just getting very, very regimented and scientifically like backing up the whole process of muscle growth, just felt really empowering. And so I decided to do a figure competition. And really what's involved with that is, hardcore exercise, 6 days a week where I was, really strength building. And then, probably about 6 months of very regimented eating. And I still, believe it or not, I eat, similarly. I'm definitely not as regimented because you can't survive like that. But, I still eat pretty clean. And the program is pretty much 6 days of clean eating. And on the 7th day, whatever day you choose, you have one meal that's, considered a treat. Right. And so your one treat meal is like pasta or pizza or, Skittles or whatever you want. And so, yeah. And so, I kind of still live that way. I don't necessarily reserve one meal, and I'm not clean eating all the time, but I do sort of live this way where I'm, fairly regimented with food, but I listen to my body more. So if my body wants, junk 2 days or whatever, I do that. I really believe in listening to your body, but I also believe that, clean eating is really important. And once in a while, it's important to also have treats. So I did. I was in a figure competition. It was an incredible experience for me. I felt totally in control of my body. I was really proud of, my 5-year milestone, and the experience of getting on stage and sort of knowing like I beat cancer and I was back in control of my body was just really powerful for me. It was a great experience, and I ended up doing another figure competition. I think a year or two later. And I am 51 years old, and believe it or not, I am getting into the mindset of, training again and rocking my bikini.
Yeah.
Yeah, so maybe when I'm 52, rocking my bikini and stripper heels again.
The stripper heels.
Yeah, yeah, for
That
sure.
takes a lot of discipline, but
It does. It
but
does.
the thing is, it sounds to me as though when you set your mind to something, you really can be very disciplined and work yourself through it or work your way through it to achieve what it is that you want. I used to work at a company called Twin Lab, and they
Oh
did.
yeah,
Do you remember Twin Lab? And
of
this was
course.
a long time ago, but I actually worked for the owners, and bodybuilders were coming in all the time. And one of the men, that one of the brothers that owned the company, he and I worked together on their magazine. And so I was always around these bodybuilders, and I remember starting to take all these different vitamins, and but
Yeah.
I never got into the bodybuilding thing, although I was really into nutrition and learned a lot then. But the discipline that at the time I did
Yeah,
not meet any
oh
men, but
yeah.
I mean women, but yeah, the
Yeah,
discipline
it's
and
very, it is, it's a, you
wow.
know, it's a very focused discipline practice. And
Sure.
and I've always been that way, you need to be when when you're getting a PhD, like there's so many times where you're like, I'm done with this,
Mm,
and so discipline and focus is really, really important. And so those characteristics are, in my DNA. But I'm also goal driven, and I like setting a goal and completing it to a fault.
right.
I like that, but it's just there's so much power in our thoughts. I'm really I often marvel at the power of human beings, and when they put their mind to anything, how powerful we all are. We
Mm,
think 60,000 thoughts a day, each person, and we have so much power and control in how we shape our everyday experience, and how you know we all in the world experience fairly similar things, right? Like some people have a little more or less of something. We
sure.
have jobs, but for the most part we all experience life in the same way, and we all mostly experience a relative, I mean, obviously there's severe socioeconomic differences and all those things, but in general we're all here in the world, right? And so
Mm,
so much of our experience is just shaped by how we perceive it, and what meaning we attach to it, and how we feel about it. You can be somebody who has very, very little, but how you see yourself and how you see the world determines your happiness. And you can be somebody who has excess and miserable, right? And so it's like so
sure.
much power in our thoughts, and how we see our experience in our world. And back to your original question early on, like how has cancer changed me? I think that one big thing is my gratitude, and the way that I experience things. I've had a lot of adversity, and I feel, I tell my husband I'm the luckiest unlucky person I know.
Mm,
um, but a lot of what I've been through has also been uh, you know modulated by the way that I see it. I'm very blessed, I'm very fortunate, and although I've had to experience a lot of things that that at the time I wish I didn't,
yeah.
I'm blessed, and I'm grateful for the things that have come from having cancer. I'm grateful for the fact that I'm healthy, and it makes my gratitude for the things that I could do with my mind and my body and my everyday experience, it makes me much more grateful.
Mm, well said. Um, I want to go back to, I know we broached the subject about the Metamorphosis Center.
Yeah.
Um, During my research, I had read about all of the different groups that the Metamorphosis Center has. Do you still have those groups? And if you do, can you mention some of them or maybe some of the things that you do? I know that you've got individual groups, you've got group groups. I mean, I
Group
mean, I don't know
groups.
another groups.
So yeah, so my group, I came up with a whole composite of groups that I offer, but it's truly organized by the population that comes at the time. In order to do a group, you have to have at least a certain number of people. So it's really, whatever presenting issues are in my practice at the time, and if we have enough people to make a group. And so I have done groups with loss. I've done groups with eating disorders, groups with helping caregivers of people who have Alzheimer's. Like I've, people are going through heart conditions, Crohn's disease, breast cancer. Like I've done many, many groups. So it really, has to coincide with the population at the time.
Mm,
But yeah, the groups are a really important um, aspect of growth for many people, because some people shy away from sharing their experiences with other people, but other people really benefit from the sense of camaraderie and shared experience.
mm.
So, you know, they're not for every support groups in general aren't for everybody, but for the people who do partake in them, many people just have tremendous benefit.
It's wonderful. There was one that actually struck a chord with me. Caregivers. to family members with dementia.
Yeah.
My dad actually, excuse me, is going through dementia and
Oh,
has for a few years, and my mom
yeah.
has been his caretaker or caregiver, and it hasn't been an easy road.
Yeah.
Like being a mom or a dad, it does not come with any manual. We all kind of have
Yeah.
to figure it out for ourselves, speak to friends, family,
Yeah.
and she's 81, and
Wow.
she recently joined an online group with those people that are caregivers to others with dementia. And when I saw that is a group that you have at the Metamorphosis Center, I thought how wonderful that is, to have for those, because I sometimes feel that it's the caregivers that kind of get lost in the
A
dust,
100%. It is
right?
such an alienating, exhausting
Perfect
experience. And
word. Perfect word.
yeah,
Alienating, not only for
yeah,
the caregivers, but there are people that just I I don't want to get into so much about mental illness, but I can talk about it because I did grow up with a father who had panic attacks and severe depression, and he still does. And with the
yeah,
dementia, it's been exacerbated.
yeah,
Um, but I've seen 52 years of what my mom has gone through, and now she's got this journey. And
yeah.
it's always been my mom, my mom, my mom. And I'm so happy that she did find this. And I was thrilled to see that you offer that.
Yeah, and that's beautiful that your mom was able to, find a community for support.
Yeah.
And I think that the advent of apps and mental health opportunities on social media platforms and on the internet is so important. And obviously, this is a burgeoning field because mental health is certainly getting its rightful spot where we realize what an important part it is for all of us, right? And so I'm
Hmm.
so glad that your mom is able to to experience that, because many times when somebody is caring for somebody who is ill, whether
Hmm.
that be emotionally or physically, they don't always have the time to get out and go somewhere or be part of a group. And because part of their experience is they don't want to leave the person, they feel so responsible, they feel like if
Yes,
they leave something terrible will happen. And so
exactly.
and they
Yes.
don't have opportunities for their own self-care. So even becoming a member of a group is like a first step for many people in a very positive direction to experience some level of self-care. And I always tell my patients, I remind them of the thing that we learn when we take a flight, which is the thing that the steward says, right? Steward or stewardess, which is that before you put your oxygen mask on someone else, you have to put your oxygen mask on first, right? You
Mm.
can't take care of somebody else unless you're breathing properly, right? And so it's so critical for caregivers to get their own support so that they have enough strength and resources to care for somebody else.
Yeah, I mean again, how you put it is perfect. And I think that that particular generation, you can understand because your parents fall within that generation too.
Yeah,
There's a little more I can do it myself. I can do it on my own. I don't need help kind of thing. And it's funny how it's evolved, especially now with the millennials who have literally brought out the word anxiety and panic attack and
yeah,
trigger even more to where people that are even my age can just simply say, "Oh, I have anxiety," without even feeling the shame of it. Or,
absolutely.
I'm going through a cycle of depression. Whereas before, I grew up in a home where it was all hush hush. And even to this day, with my dad, it's very rarely mentioned, the struggles that he's had, because there's that whole no one understands. And the thing of it is, it's very true. His generation and the friends that he's had, it's been difficult because they just don't understand it. And therefore, they don't know how to approach it or have just a regular conversation. And he's still a human being,
Of
just,
course.
you don't have to be any particular person, but it's definitely becoming, I hate to use the word more common. That's the only thing I can come up with now, but I don't feel that
It's more
people have to
validated. Yeah, it's
more
more validated.
validate it, and you don't have to hide
Yeah,
as
and the
much
fact
as
that you're doing a podcast and you are talking about your own experience growing up, in a family where there was anxiety or depression, like that models for other people this, this idea that it's okay, right? And like
Yeah,
that's what we all need to do. We need to become a little bit more vulnerable and share our struggles, because
I
everybody
agree.
struggles, right? And
Yeah,
so when we share our struggles, we get away from this idea of perfectionism, and we get away from shame and all these things that, when you go on social media, you don't see. When you go on social media, you see perfect bodies and perfect
yeah.
lives, and right, and we know there are so many, detrimental consequences, when people compare their lives to these snapshots, right? And so, people like Simone Biles and
Oh
uh,
yeah.
you know, it's very, very important. And there have been many, Michael Phelps, like he talks about having ADHD. There are many people
Yes.
who are using their public platform in a really positive way to, bring mental health into the public domain. And it's so critical and so important. And I think the world is really changing.
I hope so. I mean, it would definitely help those people who feel like they're all alone and the stigma
Yeah.
attached to it. It's definitely getting better. And so with mental health, did you notice an uptick in patients with COVID?
Oh my goodness. So I will say, um, you know, much of your career as a psychologist when you're in private practice is like, you know, figuring out where the balance lies for yourself in like what's a healthy number of people to see, what's too much. I will tell you during COVID, like, wow, everybody, everybody has been anxious, depressed. I see children, adolescents, and adults. The children were struggling because they were isolated and not social. Some of them were really experiencing learning challenges because not everybody's a visual learner or can sit on a computer all day, and they felt isolated. And so I saw tremendous, increases in anxiety and depression with children and adolescents. And then adults,
Mm.
they felt isolated. So my practice like completely became like overwhelming, literally overwhelming, during COVID, and I still am extremely busy.
Mm.
And so, I'm very, very good at balancing myself, and very good at, you know, trying to find a balance that allows me to have self care and, remain calm and centered. But I will tell you that during COVID, um, just the sheer number of people in distress, I found it difficult to um, accommodate everybody, because people, it wasn't just like new people, it was people, from years ago calling, and,
Mm.
and just wanting to talk. So it was really overwhelming. And I still think it's a lot. People are still in this space.
Sure.
And I do think that COVID will present challenges to mental health, unfortunately, for years to come, because I think that it did change a lot of how people experience themselves in their world. And I also think, on a positive note, many people are reevaluating the manners in which they want to live. People are changing where they live. They're changing, the rigor of their day, and they're realizing that, working 12 hours a day isn't healthy.
Mm.
I think more self care. I think people were eating more with their families and having family game night, and they really enjoyed
Sure.
that. And they
Yeah.
liked walking their dogs,
Right, right.
right? And so, yeah, lots of changes.
Yeah, you know what? But with change comes some really, really, really great, great, great things and more positive things. I'm not saying that, oh, it's a great thing that we all had COVID because we're all
Of
learning more
course.
about ourselves. I'm just saying, like with your journey with breast cancer and how many extraordinary things that came out of it and everything that you mentioned before, it's sometimes it can actually turn into being a more positive thing,
100%. A
right?
hundred percent.
So now you'd think that Renee would slow down after all these accolades that she's achieved, but no, no, no. She had other thoughts. Renee is also an author of Chemo Muscles: Lessons Learned from Being a Psycho-Oncologist and Cancer Patient. And just a little intro, in her book, she looks back at her own experiences of her diagnosis. It's a book about coping techniques to help others face cancer. So clearly, that time in your life cultivated other ways of viewing yourself in your life. Is there anything that you can share about your book with
Oh,
that was maybe a
sure.
priority or priorities that you wanted to add into so other people could help
Sure.
themselves?
Yeah, I mean, I thought that I was in a unique position because, as I said, I was a psychologist in a pediatric cancer center for 6 years. So I worked very closely with children, adolescents, and families during their journey with cancer. And so I saw a lot from the practitioner or, doctor standpoint about how people were dealing with these struggles. And I learned a lot about empowerment and ways that people are disempowered and coping techniques. Like I researched a lot, but I learned a lot firsthand. And interestingly enough, um, prior to getting my PhD, you have to do a dissertation, and I actually did my dissertation on women with breast cancer, which is just a very bizarre, weird circle of life and circle of cancer.
Mm.
I have no family history of cancer, but here I am. On women with breast cancer, worked in a pediatric cancer center, and then was diagnosed. But I was in a unique because I had experience, and then it was the personal experience. So I wanted to really talk about coping techniques that I learned about, and talk about that health professionals can really or positively impact our journey through the medical experience. I had so many incredibly caring, wonderful people who helped me, who made my experience much more difficult. And there are really subtle things that I think that people need to learn when they're in the healthcare profession. Even our nonverbal language, it contributes a lot to a patient's experience of what they're going through. If I used to have, when I would walk into the pediatric cancer center, a patient's room, I used to have parents look at me and say, "What do you know?" And I'm like,
Oh,
"What do you mean? What do I know?" And, when you're a patient and you're, in the experience of being so, you're literally hanging on to anything. Like you have no control. And so you're relying on, and so when a doctor walks in, you experience them as the one who has the information, or the person who's going to make your child better. Right. And so
right,
you
right.
really, holding onto everything. So I became very aware of that as a psychologist. But then when I was a patient, and I would deal with these technicians who, wouldn't speak to me, or would have these ominous looks on their face and would walk out, like, it was really traumatizing.
Mm.
And things like even telling our story, early on, when I wasn't quite ready to share, details about my cancer, very well intentioned friends and family had shared things with other people because they needed a place to cope. But at the
Mm.
time, it was incredibly disempowering for me, because when you're going through your own trauma, one of the ways that you maintain a sense of control is having your own story, to tell it
Yeah,
when you
yeah.
want, to tell it to whom you want, and to share what details you want. And so
Yeah.
I learned a lot about trauma, like I said, both from a professional and personal standpoint. And I thought it was really important to relay very specific researched coping techniques that I know were highly effective, because they helped me tremendously and they helped my patients tremendously, as well as bring some illumination to how we should be educating all healthcare providers so that they can, in the future, treat their patients with a greater level of dignity and respect.
That's incredible. That was actually the next question I was going to ask you. That as being a professional, uh, I could only assume that you were talking about how you became empowered personally, but of course, being a mental health professional and helping others with it certainly helped. And I would wonder about if this was very therapeutic. Now, I know that you went through your journey,
Mm-hmm.
and the last part of the journey, well, I don't think you'll ever have an end to your journey. I think it continues, but the book seemed not only empowering for you and for others, but it certainly kind of, I would think, concluded everything that you've kind of done up until that point to
Yeah.
allow you to say, you know what, this is my own personal journey and I want to share it with everybody who's going through such a difficult time, especially coping mechanisms, because a lot of people don't even know what that is, what the
Right.
word
Right.
coping, I mean, you've heard of
Yeah.
it before. And
Yeah.
I think that it's such an empowering thing for you to continue helping yourself and helping others. Was there like a shift or like a paradigm as you were kind of going through writing? Did it also enhance more of the coping or make you feel more empowered? Was there any kind of like a shift?
That's such an interesting question because, for me, when I first started writing this book, um, there was so much going on for me psychologically, and you know, I was really at such a different psychological place. I was
Yeah.
much more of a perfectionist. Like so many different things. I wasn't somebody who shared struggles at all, and so I would say that over the years of writing the book, I noticed within myself my own identity changing, where I allowed myself to become, much more vulnerable and allowed myself to become much more okay with my own struggles. And so I think that, the book took me, I wrote it for, a year or two, and then I completely shelved it.
Mm.
I wasn't really ready to sort of put myself out to the world in such a vulnerable way. And so I shelved it for several years. And then around 2014, my dad was diagnosed with lung cancer, unfortunately.
Mm.
And shortly after he passed away, I decided now's the time to, get back to my book. And I
Mm.
was kind of, I was ready to sort of put that out to the world. And literally, that's when I had a breast cancer recurrence. And so that was like my whole second chapter. And although I want, material for a second chapter, that too was a really powerful journey. I went through radiation and chemo, and and it was all very young. It was young. I first was
Yeah.
diagnosed with cancer at 37, so I was young.
Yeah.
Um, but I think that by the time I finished the book, writing the book, so much about me had changed, and the coping techniques that I mentioned, every single one of them helped me on my journey. Every single one of them.
Yeah.
I talk a lot about humor. I talk about this radiation playlist that I came up with when I was going through radiation. Like
Right.
some of this is like sick humor, but like
Oh, I know.
they
I mean,
really
what?
helped
No, I mean,
me.
right. Whatever can help you to get through it.
Absolutely. And I true, everything that I write about has been researched. It Humor does help us, exercise does help us, food helps us. I mean, human touch helps us. I mean, I list tons and tons of things that not only can empower someone during their cancer experience, but through much of life adversities in general. Like we all go through things, we all need ways to cope with, challenges that life throws at us. And every single one attitude, and they're all, you know, clearly demonstrated to help, and
Mm.
so, I practice them all on a daily basis. I wake up in the morning and the very first thing I do is, I thank God or the universe or whomever, for giving me another day. And I
Yeah.
literally live that way. And not because I don't feel like I'll have actually live in that space at all.
Mm.
But just because I'm grateful. I'm grateful for, everything that I have. I'm grateful to be talking to you. I'm grateful for
Oh,
this opportunity to, it's for real. Like I'm grateful for, the opportunity to even be able to potentially help somebody else. So it's all gratitude. And,
I just wanted to ask, do you journal at all?
It's funny. My journaling, is sometimes just little notes in my phone. I write
Mm.
a lot. I write a lot, of articles, and I'm actually working on a second book. But so when I journal, it's not necessarily like me getting in touch with my thoughts and writing like, "Dear diary, today I
Right.
saw John and he's so hot." It's not like that kind of
Like I
journal.
did
It's
when I
like,
was like in middle
right, like,
school.
right, you wrote the big heart, Julie and John forever, right? Like it's not that. It's like more,
How'd you know
if
about
I
John?
can't, it's more like 3 o'clock in the morning, or I'm just in the car and like a thought strikes me, I just write it in my phone in a little side note, and they essentially become, thoughts that are in some writing.
Right,
So
right.
yeah, so that's what I do.
Okay, I just want to mention that you can get Renee's book at Amazon.com. I'm going to actually head over there because I do not have a copy of it. And I am really looking forward to reading it. Although I do not have breast cancer, I'm still so interested in reading more about your journey, just reading your words because you're amazing. And also, the
Thank
coping
you, Julie.
mechanisms. So I'm going to just ask you one final question and something to maybe leave us all with. Do you have any words of wisdom that you could share with us?
Oh, words of wisdom. I feel so like what a podium for power right now. Wow, I'm
There
going to
you
be telling
go.
something big to the
More
world.
empowering.
Well, other than this trick that like broccoli is, if you want chocolate, because that's like a pretty cool word of encouragement. I have so many things. I guess this quote that I like, which is that smooth seas don't make good sailors, right? And so
Hmm.
it's a really beautiful thing for us to acknowledge our struggles and the things we feel are our detriments, and understand that these are our gifts to that make us stronger people. Nobody wants to go on a ship with a captain who has only been on calm, nice waters, right? And
Hmm.
so you really want to facing difficult storms, right? And so I think it's an amazing thing to know that you can steer your own ship, whatever life throws at you. And throws really, really bad storms our way. But we learn to cope, and we learn to grow, and we learn to find strength within us that we didn't necessarily know we had. And we go and rock it. So those are my words of wisdom.
Well, that was wonderful. So that was just incredible. I'm going to probably steal that one, but I
You
won't tell
go.
you I'm going.
Feel it. Go
So,
for it.
Renee, you're an incredibly amazing person. I'm so glad to know you,
Thank you,
and I'm so glad that
Julie.
you did this with me. You can find Renee on Instagram and Twitter under the username Dr. Renee Exelbert. LinkedIn, she is Renee Exelbert, PhD, and she also has a website, www.drexelbert.com. Thank you, thank you, thank you. You
Thank you,
really
Julie.
you're an incredible
Beautiful
person.
day.
Thank you so much. Same to you.